Hi, Ayla Brown with WSPA. Really, anyone can answer this question, but it kind of goes back to the city's campaign with the mask up signs that we see throughout the city and the hand sanitizer, and I think there's even a hand washing station maybe down by the CVS. Maybe we can speak to how that campaign, seeing those things pretty prevalently in our community, has kind of contributed to the decline that you all have seen as far as patients entering the hospital.
So we really think that that's actually, made a difference, and I'll tell you, there's another one coming out shortly with us in Prisma around masking up and hand washing, because we felt like that, multiple people have done them, around town and in the county, and they've been affected. So we're fixing to come back with another one just to make sure that we keep it forefront in people's mind.
I know that also previously we've talked about how there is the potential for this to get worse come the fall. So although that we're seeing a decline in the numbers now, which is obviously a good thing, can you just reinforce the fact that, we have to keep doing what we're doing to keep those numbers where they are and get them even lower?
Right, and Dr. Osmond, Dr. LaCroix both did that, but I think, the big thing, masking, hand washing, if you're sick, stay home, don't go to school, don't go to work, but also, getting the flu vaccine. I mean, that's going to be really important. It's important every year, and we try to push it every year, but I think it's, exceptionally important this year given the situation we're in.
Jane Rebelo with WYFF News 4. Two quick questions. The first would be, there's some questions that we get from viewers about the numbers of people who have died. As you all report those numbers to DHAC, is it people who have died from COVID or people who have died with COVID?
Okay, so you're going to put me on the spot here, and that's fine. What we report is deaths that people that have a positive COVID test. So what we report is, is a patient who dies who has a positive COVID test. That's what we report to DHAC.
So it doesn't necessarily have to be that COVID was the cause of death, but when they died, they were positive with COVID.
Right.
Great. The other question would be, we've heard Dr. Fauci speaking now about maybe temperature checks aren't that important. Where do you doctors weigh in on, because that's kind of the first thing, we're still taking temperatures and we're still looking at that as a measure of whether or not someone may indeed have the virus. And the other question would be, I've heard conjunctivitis might also be a sign, but that's not one that we're hearing about much. Right. How do you three weigh in on those two signals?
So, from our standpoint, as a system, you routinely look at what are the recommendations from the CDC and other places, and that's continually being evaluated. I think, from our standpoint, we haven't backed off of temperature checks. We still think that, any kind of barrier, that we can use to potentially catch, somebody with a fever that they're not aware of from that standpoint is still going to be beneficial. As far as the conjunctivitis, Dr. LaCroix, you want to address that?
So conjunctivitis and even skin rashes have emerged as we've learned more about the disease and its multitude of ways that it can manifest. And so certainly conjunctivitis, particularly in combination with other things, respiratory symptoms, has been well described. That also describes a number of other viruses. So that's where having someone who is having a symptom seek either going through one of the online screening tools to determine if they need to be tested, or seeking care with their provider, which now can be done through a number of different ways, both via telehealth and also via in-person visit. But it allows you to put the whole clinical picture together, and that will give someone a better idea, because we know conjunctivitis is common with other viruses as well, but definitely has been described.
We've also you all were talking about a fear of maybe a resurgence or another upswing in October or in the fall. Can you speak to, we're getting a great attaboy for the community, but I'm also hearing every one of you, including the mayor, say, but we've got to keep this up. What are your fears moving forward? Is football season a fear? Is back to college a fear?
So Jane, I think there are a couple things. One, we all, everyone in this room has learned that this is a relatively unpredictable disease process, and that the ability to prognosticate out beyond 2 weeks is very difficult to say. So, the concern looking at Labor Day and then potentially looking at football season and all the things that happen in the fall is that we would have people congregating again, not wearing a mask, not paying attention to social distancing, assuming the virus has gone away. So I think keeping that message up about the importance of masking, social distancing, hygiene is absolutely essential. And then, to comment on the temperature piece, dealing with COVID, there is not one solution that makes the disease go away or significantly makes us safer. We have multiple overlapping imperfect controls. The mask is an imperfect control. Taking people's temperatures is clearly an imperfect control, and that, we know 30% of the folks that have COVID, maybe even more, don't have symptoms. They don't have a fever. We also know that one of the top, symptoms of people that do have symptoms with COVID is a fever. So I do think it is an important component of our preparedness and our safety plan, but it's not perfect. So, going into the fall, really just we've got to keep this up. Thank you. Oh, with respect to football and sports, I certainly think going back to sports is obviously one of the challenging things that we're going to face in the fall. There's a lot of folks that have put serious thought and effort into this. As Dr. LaCroix said, the schools have spent a tremendous amount of time on this. So I think keeping up everything we're doing, I do remain optimistic that we can get through the fall and get into a season where potentially we start to have some more options, potentially for vaccination for this disease.
I'm Eric with the Charleston Post and Courier.
Mm-hmm.
Is there any, can you explain to us what you're seeing in terms of severity of cases since this started? Is there any trend in there not being as severe or any change at all?
So the trend in the cases that we've seen over the summer, and we've talked about this before, is it's definitely skewed younger. So the population, in March and April was an older population. As we got into summer, the average age of the population with COVID dropped. The severity of the disease hasn't really changed a whole lot on the hospital side of it. What we don't know, though, as a community is, how broad the low severity or the asymptomatic cases have circulated. So we can't really speak to that right now. But on the hospital side, age has dropped, severity has remained fairly similar to what we were seeing in March and April.
I think people might be interested when you say the masks work. How do we know that? I mean, what are you basing that off of? I mean, it seems like an obvious correlation, but is there anything you can share with people as to why you draw that direct correlation?
So I think there's an emerging body of scientific evidence that is showing that when a large portion of the population masks, the transmission of the disease goes down. And this is really, in the hospital, we use a mask to prevent the healthcare worker from acquiring a disease that might be within their environment. But in the community, what we're doing is we're preventing people from expelling respiratory droplets and infecting others. And so when I wear a mask here, I'm wearing it so I don't infect you, not so that I get an infection from you. And that's the important distinction.
Kirk Brown with the Greenville News. DHEC's daily reports have shown less people are getting tested across the state in recent days, weeks. Are you seeing less people getting tested in the Greenville area?
We are. And
What's the reason?
Well, I think there are probably two reasons. One is the prevalence of disease in South Carolina and the Greenville area is dropping, so there are probably fewer people that feel the need to get tested because they have symptoms. And then the second is potentially there's a component of testing fatigue where, you know, people have gotten to the point where they don't feel it's necessary to get tested. And to that point, I would say, if you have symptoms, if you have concern that you potentially have COVID, you need to get testing. There are multiple sites where you can get that, both within the St. Francis system and within Prisma. And please, if you do have symptoms, get tested.
And to follow up on the percent of positive tests, it's still well above 10%. What's the number you folks are looking at as an indication that it's not being actively spread in the community in terms of the percentage of positive tests?
So the WHO has identified 5% as the level that a community wants to get to indicate that the disease is under relatively good control. In South Carolina, we're still in that 16% range, so we have a ways to go. So even though this is a very positive conference we're having today and good news, we really need to keep these efforts up to get down to that 5% level.
I just want to follow up on one of your answers there. You're urging people with symptoms to go and get tested. Obviously, that's, for their own well-being, but does making sure that if you get tested, if you have symptoms, put that number on the radar and help you all as doctors, really have accurate numbers to what we're actually dealing with in the community?
Absolutely. It's incredibly important for the individual so that, they know that they are potentially, that they have COVID, and that others around them are potentially at risk. So absolutely essential for the individual, but also critical for the community and for the state so that we know, where these disease clusters are occurring and we can target resources to mitigate.
I worked on a story yesterday with REWA and Clemson University about testing wastewater for COVID-19 particles as a way to track, more accurately really what the community is looking like. The professor who is analyzing these details, it's just from the Malden Road REWA facility, but says, although the numbers have gone down, they haven't seen a number in the particles in the water go down yet. So does that show that people, we're seeing a decrease in new cases, but people in the community do still have COVID-19, right?
Absolutely. I mean, in that, what you're referring to is really fascinating, cutting-edge scientific research. But as Dr. Blackstone can tell you, as I can tell you, we're still seeing COVID-19 patients in the hospital. We're improving. Things are getting much better, but folks are still getting this disease, and we cannot, particularly going to Labor Day holiday, just pretend like this has gone away, because it certainly is not.
Right, you mentioned the holiday coming up. The last time we had a holiday, we saw a pretty significant spike in cases. I would imagine we don't want to be dealing with that again.
No, absolutely not. So have a wonderful Labor Day holiday, but have a socially distanced and safe Labor Day holiday.
Wonderful, thank you.
Thank you.
Well, some good news there, but a lot of caution at the same time. I do want to harken back to previous conferences we've had. Dr. Blackstone did a good job early on, in particular, holding up the mask and telling people to wear that mask. And Dr. Osmond said the same thing, that it's something we can all do. This is not something as an alien that's invaded our community. This is we can stop the spread by playing a role in making that happen. And I think the message today is, perhaps as a community, with the mask ordinances, with the efforts of private businesses to require masks, with the governor's actions on the restaurants, for example, that it's made a difference. And just as we've made a difference now to slow the spread a bit in our community, it's up to all of us to make a difference in the future going forward so our small businesses can reopen and thrive so we can get back to normal. So good news, but cautionary tale at the same time. So thank you all for being here today, and we'll see you in hopefully a few weeks, and hopefully we'll continue to slow the spread in Greenville. Thank you.